now back to Insights on Leadership in Life with your host, Roberta Pickett.
Welcome back to Insights on Leadership in Life. I'm your host, Roberta Pickett, and I'm here this evening with guests Kim Vagt and Marv Hampton to talk about healthcare. As healthcare is definitely on the radar these days, whether it's from the Affordable Care Act and the impact on doctors and medical facilities and insurance and our costs, as well as, the measles outbreak and Ebola and the aging of all of us baby boomers. So, wherever you turn, something around us is affecting our health care. And that's what we're here to talk about this evening. So, Kim, as Director of Ancillary Services, and Marv as Chairman of the Sutter Amador Hospital Foundation, I think both of you have some things to share. There's a lot of new things happening as a result of the Affordable Care Act. And strategic changes in your facilities, right? So something big is happening as we speak. What is that?
Well, this is day 5 of our go live for the electronic health record. So that means that there are no more one patient chart shared by 20 different healthcare team members. We all are doing it electronically, and the reason for that is really that it will achieve even higher safety and quality because all the information is there historically for a patient. If they've entered into the Sutter Health system anywhere in our Northern California ED, in a physician's office, in the hospital, all that information will be there to help support a historical perspective for them.
Yeah, I know it's huge, and having been part of the Sutter Network previous, not this here, but in Sacramento area, I know what that's like. What about when a patient transfers from another system? Do those electronic medical records transfer as well?
It's all shared now with all the Sutter Health affiliates. So our region, which there has been traditionally 5 regions in Sutter Health, we're the last of the regions to go live in acute care. The physician offices, which is all ambulatory, all those foundation, Sutter Medical Foundations, they have already been live with electronic health record for 2 years, and they're like, we can't wait.
Get on board.
We can't wait for the hospitals to come on board so that we can share information, lab work, imaging, reports, all the medications that people are on that they never remember, advanced directives, all that is in there.
So where it was in a chart before, but to transfer that chart from one doctor or from one facility to another was a complicated and probably haphazard.
And not safe, really, So this is really safer care. It's really high quality care, and we're really excited about it. Ann Platt, of course, would have loved to have been here tonight to share that success, but she has literally been going all week,
I can imagine.
Starting early in the morning until very late at night, and she is in there, just making sure that all the pieces are connected.
And Ann is the CEO of Sutter Amador Hospital,
Ann
right?
is our wonderful CEO, and she's my boss.
Yeah. And so these electronic health records, are they part of the software, or is it a whole different system? Technologically, what
it's
are
all, the software is Epic, that is a very...
And that's used not just within Sutter, right?
Yeah, it's a lot of different healthcare systems. It's the largest, software system for healthcare.
So this is like a huge upgrade to that software system, right?
Yes.
Yeah,
every different health organization can tailor it to them, but we need to do it collectively as a whole Sutter system. So
that it does sync.
Right. And it shouldn't really matter whether you're seen down in San Francisco at one of the hospitals down there, or whether you're seeing here, everybody will have access. All the physicians, all the providers, will be able to have access to that very important healthcare information.
That's big. In terms of how it impacts the Affordable Care Act, or what's the connection there?
I'm not really sure on that, except that it helps us in affordability. Just as one prime example, we were a little worried about our revenue and our charges crossing over with going from paper and how we used to do it to the electronic, and we were reassured by all the revenue people that are here helping us that all of that passed over and we're right on track, and maybe even a little bit more than what we had projected. So you never really know until you go live what really crosses over. So probably definitely helps with a little bit of affordability. Sutter Health has been working really hard to try to afford, the electronic health record. It cost, millions of dollars,
right.
And it's
a huge expense to put in, and yet huge asset once it is done to not only to your facilities and to your organization, but also to the public,
exactly.
to the patients.
It is the right thing to do for our patients.
Yeah. That's great.
We feel really good about it.
Oh, good. Huge project.
Yes.
And I know it's been a long time coming.
Yes.
So speaking of the foundation now, and being the new chair, do you have new goals for 2015, Marv?
We do. Last year, I'm happy to say, we achieved our goal for the new mammography unit.
That's a 3D unit, right?
Yes.
Amazing.
It is. And, one of the goals that we strive for is to try and have as much at this hospital as we can, so people don't have to go down to Sacramento or Stockton or another area to receive services. Every year we set a goal, and if we achieve that goal, we apply for it, and we have been fortunate to get a matching grant from Sutter Health. So this year, our goal, and that we're asking the community to get behind, is a cancer infusion suite, which would mean no one would have to leave this county to get their treatments for cancer. It's a very big undertaking.
Yeah.
The value that we have on it right now is $1.2 million. Now, we're not raising $1.2 million.
Well, you'd like to.
Well, yeah. Yes, we would. Our goal is to raise $150,000. We have an entity within the community that has already donated $450,000 to this project.
That's huge.
If we raise the other $150,000 by the end of the year, this year.
Yeah, 2015.
Right. Sutter Health will match it to $600,000, making it $1.2 million. Once we can say we can have this suite, then we can look at getting an oncologist to come up here at least once a week to take care of the cancer patients in this area.
So what that means is someone who's going through chemotherapy and has the chemo treatments can do it right there at our hospital. I know when my dad had cancer, he had to go down to Stockton all the time. And it was, you're already depleted, and to have to go down, it was a very trying time, on top of everything, just the travel itself. So that's a beautiful goal that you guys
It's
have.
a wonderful goal. I really am real proud of our foundation board and the 17 current members we have on it.
Can you name them all?
I've got my cheat sheet right here. I'd be happy to, because these are very, very dedicated people. One of the things, too, with our foundation board is every member of that board gives. We make it a habit of saying, we don't ask for anything that we don't do ourselves. So every member of our foundation board gives every year to our project. I'm the new chairman. Ann Lentz is our sub-chairman or backup chairman.
Co-chair.
co-chair.
Or, yeah, vice chair.
We also have Betty Satterley, Colleen Reardon, Darcy Porter. David Carlson was our chair for the last 3 years. Dr. David Melnichek, Dr. Paul Beatty, Doris Dunn, Jenny Ruckelhaus, Jim Gillette, Kevin Spence, Loretta Porteous, Paul Molinelli Jr., didn't say that very well, Paul Molinelli Jr., Paul Sabone, Rose Reditic, Sharon Long, and last but not least, Supervisor Richard Forrester. It's quite a dynamic group.
I was going to say, you've got some very well-known names in that group. Yeah.
We do, and basically our job is to ask people to donate something towards the cause. I know on March 4th we're having a appreciation dinner for all the donors last year. This is a community that gives to everything, and we are so fortunate to have this hospital in this community. I know you kind of take it for granted that it's there, but I know when they built it, I thought, nobody is building hospitals like that in small communities anymore.
I know, we're very fortunate.
Very fortunate.
And the reputation of the hospital has really grown over the last decade or more, and it's
Well,
it's
and a
really
lot of
nice
that has
see.
to do with Ann. We like to say she's the inspiration for our dedication. She's doing a wonderful job.
Well, actually, hold that thought, because I really do want to talk more about leadership, and I think that's what you're referring to, that she's an incredible leader. And in the next segment, I'd like to get more into that in depth. But right now, we need to take a commercial break and thank our sponsors and TSPN for being here. So we'll be right back with more insights on leadership in life.